Dear Algerian friends, hello. My name is Nicola Montano. I'm an internist and I'm a professor of internal medicine at the University of Milan. And I'm also the immediate past president of the European Federation of Internal Medicine. First of all, let me thank you, the president of the Algerian Society of Internal Medicine, Professor Tebaibia, for this kind invitation. I'm very sorry that I have to attend your meeting only virtually, because I would have loved so much to come to Algiers. But unfortunately, last year and this year, the pandemic didn't allow me to come. But I really hope to be able to join you in presence in the near future. So the topic now of my talk is something that I've been studying for a very long time, which is sleep deprivation, in particular the relationship between sleep deprivation and cardiometabolic disease. So let me outline that we are talking about preventive medicine. And you know that in preventive medicine, there are pillars. So we know that physical activity, a good nutrition, and the right amount of sleep are necessary to stay healthy and to reduce the risk of disease. Beside of this, there are two not to do things like smoking and not abuse of alcohol. So we are talking about preventive medicine. And since we are talking about sleep, let me just provide you my take-home message before you fall asleep while I'm talking. And my take-home message is that sleep alterations are linked to an increased risk of cardiometabolic diseases development through a complex interplay with the autonomic nervous system. I will briefly talk about sleep, the relationship and the importance of autonomic nervous system in regulating sleep, and also in linking sleep to cardiovascular disease and cardiometabolic disease. And we will briefly outline the future agenda of this kind of studies. So sleep consists of two macro processes, a circadian and homeostatic. You see here, the circadian rhythm is the so-called wake-sleep cycle, and it lasts 25 hours, and it's the correct alternation of sleep and wake during the day. We know that the circadian rhythm is regulated by an homeostatic process that can be also defined as the pressure to sleep. So as you can see here, the pressure to sleep is minimum when we wake up in the morning, and then increase during the day and becomes higher during the night. We don't know exactly what this homeostatic process is about. Maybe some substance which is accumulated during the day, but this is these two, the circadian and the homeostatic process, are responsible for our wake-sleep cycle. Moreover, sleep itself has a specific quantity and quality definition. As you can see, there are three major stages plus the rapid eye movement stage. And so there is, from wake, there is, there is a deepening of the sleep until we reach the stage 2 and 3, which is the deep sleep, also called slow wave sleep, because the electroencephalographic hallmark is characterized by these slow waves. And then, once in a while, we have this REM stage. And you can see that during the night, the deep sleep is concentrated at the beginning of the night, while REM sleep is more concentrated within the early morning hours. Okay, so this is something that has to be maintained. So not only the quantity of sleep is important, but also the quality of sleep. So the timing of slow wave sleep and REM sleep. What sleep is about? Why is so important? For sure, now we know that one of the reasons for which sleep is so important has to do with our cognition, because sleep favors synaptic plasticity and the storage of learned information. Basically, if we would not sleep, we would not be able to store what we learned, okay? And since during the day, we are building synapses, during the night, a lot of synapses that have been built and which are not useful for us are destroyed. And so during the night, and during sleep, there is an increase in the connective fluxes of interstitial fluid, which clear the beta amyloid during sleep. We know that beta amyloid is also related to Alzheimer risk and dementia risk. And so now we know that sleep is very important, and maintain the correct amount of sleep is very important to prevent not only cardiometabolic disease, but also dementia. You know, there is a different, during our lifetime, the sleep structure change, and also our need of sleep change. So, you know, since newborn, when we sleep 2-3 hours and then we wake 2-3 hours continuously, then we, you know, during the childhood and adulthood, we have a separate sleep time, and usually, you know, we sleep an amount of time between 7 and 8. So what is clear that the sleep duration has dramatically reduced in the last 100 years. So we went from 9 hours in 1910 to 6.8 hours in this last poll of the 2005. So we are losing 2.2 hours of sleep per night. And this is not trivial, because this has some side effects that are very important for our health. What are? And you know, in 1817, so almost 200 years ago, Robert Owen, a physician, an English physician, wrote this rule, talk about the 8 hours rule. So for having an healthy life, we should have you know, we should pass 8 hours at work, 8 hours for rest, sleeping, and 8 hours for leisure time. And now we are rediscovering this, because we are realizing that we are working too much and relaxing too little time. But, you know, this was known even 200 years ago, that to sleep 8 hours is good for our health. How many hours do you sleep? When I usually perform this question during the seminar, usually, you know, the majority of the people sleep 7 hours. And this is good. And this is good because 7 hours is a reasonable amount of time, because to sleep more or less may be associated with other problems. Why there is sleep deprivation? There are different reasons for reducing the amount of time that we sleep. One is sleep fragmentation. So for aging or for disease like sleep disorder breathing, like sleep apnea, periodically movement. So we have in sleep fragmentation, the time that we pass in bed may be 8-10 hours, but the quality of the sleep is completely modified. Or we can reduce the amount of time because of shift working. Nurses and physicians, you know, we we are on call at night. However, be careful, because if we stay at work one night, then we recover immediately the other night. While the worst shift work is those in which we work for 1 week at night, for the next week during the morning, and the other week during the afternoon. So this is a real bad shift work. Is not the acute night that we lost working in the hospital. Or newborn baby parents. I mean, well, my second daughter did not sleep until she had 3 years. She was 3 years old. And this is the reason why I decided not to have a third one. Another, a chronic restriction of sleep can be due just to our lifestyle choice. We decide to stay awake during the night and to go to bed late and to get up early to go to work. Or because we have an high pressure work schedule, or because we decide to do this, or because we cannot really sleep because we are insomniac. And another way is a total sleep deprivation, but this is really an acute setting in which usually, the problems related to that are less, as I told you before. So how can we summarize what are the symptoms and signs of insufficient sleep or fragmented sleep? Very few. Only, let's say, 70% of 60% of the sleep deprived people does only, refer excessive daytime sleepiness. So they have the tendency to sleep when they are reading, when they are driving. Of course, may cause a lot of problems, a lot of troubles, but this is the only one. Then, after a while, they may have neurobehavioral deficit. They may have attention and concentration deficit, cognitive function impairment. They may have a lot of errors of performance. So they have a lot of, they can make a lot of mistakes at work. And also silently, a cardiometabolic disease can progress. And the first thing that, they appreciate is an increase in appetite, increase in weight, increase in high blood pressure. All these effects may increase morbidity and mortality and then decrease the quality of life. There are a lot of indirect costs of sleep deprivation, which the RAND Europe organization calculated. And they, concluded in this survey that who sleeps fewer than 6 hours on average have a 13% higher mortality risk than people who sleep at least 7 hours, and at the national level up to 3% of gross product is lost due to lack of sleep. And what about politicians sleeping? When they are sleep deprived, we know that, these are all Italian politicians, we may have some problems. So what is the link between sleep deprivation and disease? Why, if you are sleep deprived, you get sick? This is because there is the autonomic nervous system. And the autonomic nervous system is a crucial link between our mind and our body. And we know that it's pervasive and it's the autonomic nervous system relies with the functioning of all our viscera. And we know very well there is a relation between the stress system and autonomic nervous system. So any situation characterized by anxiety, fear, or any stressful condition, physical or emotional, is associated with an increase of sympathetic nervous system. And also the increase in sympathetic nervous system can alter the sleep-wake cycle, because the sympathetic nervous system is very important and crucial for our evolution. But if we use too much the sympathetic nervous system, if we are too much stressed, then we also reduce our sleep efficiency. So, you know, just to briefly to show you exactly what the sympathetic, why the sympathetic nervous system is so important, I would like you to watch this video. So, as you can see, the only way that we have to survive is to have a sympathetic nervous system very active. But, you know, we live in a world in which we are stressed. We don't, I mean, we are not catching our food, fortunately. But usually we exercise very low, we eat too much, we don't sleep. And so this increases the activity of the sympathetic nervous system. So what happens during sleep at the sympathetic nervous system? During sleep, the sympathetic nervous system goes down, as well as the heart rate, the mean blood pressure. You see here in a human in which the sympathetic activity is recorded through a microneurographic recording, there is a decrease in burst activity and in burst amplitude. This is a study by my friend Viren Sommers, where I worked with in Iowa City for many years ago. And so you can see here very clearly, this is the sympathetic nervous system. This is awake, pressure. During stage 2, there is a decrease in the burst, so decrease in sympathetic. Stage 3 and 4, deep, slow wave, you know, there is a shutdown of sympathetic, and then during REM, there is a huge increase sympathetic. So during the night, there is a reduction in sympathetic nervous system. And this is the reason why during the night we have a decrease in blood pressure. This is the circadian regulation of systolic and diastolic blood pressure, and this is heart rate. And so during the night, there is decrease in blood pressure, decrease in heart rate, and this is a good sign. And this is also very protective for our cardiovascular system, and this is the reason why during the night, the rate of sudden cardiac death and myocardial infarction is much lower than during the day, with a peak during the morning, so at the awakening, because the sympathetic nervous system is low during the night, and the vagal activate and the parasympathetic nervous system is high during the night. So, what is the relationship between sleep deprivation and risk factor? This is a very nice study performed in the control subject in two group of healthy volunteers. In one group, these subjects were sleep deprived totally for 3 days of sleep. And another group, they were, the sleep time was just restricted to 4 hours for 10 days. And these researchers just measure the C-reactive protein. And you can guess in which of the two group the C-reactive protein increased more. If your answer is in the chronic restriction, this is the right answer. And you can see here that in the 3 days total sleep deprivation, there was an increase in the C-reactive protein, but this increase did not reach the threshold of risk, while in the partial sleep deprivation, as you can see, from day 1 to day 10, C-reactive protein increased a lot, overcoming the threshold of risk. So there is a relation between sleep deprivation and increase in inflammation. Not only, but there is also a relationship between sleep habit and susceptibility to viral infection. And this is a very nice, very easy paper in which researchers studied 153 healthy men and women. And they divided into 2 groups according to a sleep questionnaire: poor sleeper, good sleepers. And they injected in the nasal mucosa flu, the virus flu, nasal drops containing rhinovirus. And they see that the risk of developing cold was 3 times higher in the poor sleeper than in the good sleeper, meaning that those less sleep deprived were those with a higher boost of immune system. So think also, you can think now also that we are dealing with a pandemic, with a viral pandemic. So this means that we sleep more, and if our sympathetic nervous system is not so high, we help our immune system to respond to the viral. And so there is, you know, in the last year have been highlighted importantly the relation between sleep restriction, sympathetic activation, and also pro-inflammatory status. So if we sleep less, the sympathetic activation is higher, and this sympathetic activation is associated with a major release of pro-inflammatory cytokines. So there is a strong relation with the sleep, inflammation, immunity, and autonomic nervous system. And now, we know very well that there is a relation between insulin sensitivity and sleep deprivation. You see, these are all the major studies conducted in the last years, in which you can see that, you know, acute or chronic sleep deprivation is associated with with a decrease in insulin sensitivity, which is just the prologue of diabetes. This study published by the group of Yvonne Cauter of the University of Chicago years ago, in my opinion, highlights very nicely what is the relationship between sleep, autonomic, and insulin sensitivity. They studied 9 healthy young subjects in 2 randomized conditions, 2 baseline undisturbed nights versus 3 nights under total sleep deprivation or slow wave sleep without modifying the total sleep time. And they measure insulin sensitivity and heart rate variability, which is a non-invasive technique to study the marker of autonomic nervous system. And so what they saw is after 3 nights of sleep deprivation, there was a decrease in insulin sensitivity. And this increase in insulin sensitivity and glucose tolerance was associated also with an increase of the sympathetic marker of cardiovascular modulation. And you know, they hypothesized at the end that slow wave sleep play a major role in maintaining a normal glucose homeostasis, that reduce sleep quality as it occurs in aging may contribute to the increased risk of type 2 diabetes, and an increased sympathetic activation may be one of the mechanisms involved. And so we are closing the loop. Sleep deprivation, increasing autonomy, increasing inflammation, decreasing insulin sensitivity, and then diabetes or obesity. It is clear, different study has shown that sleep duration and risk of type 2 diabetes are tightly linked. And you can see here that there is a J-shaped curve. So the problem is not only that sleeping less than 7 hours is detrimental, but also if we sleep more than 9 hours. This is because sleeping more than 9 hours may be associated also with some depression state or some psychiatric illness. So this is the hypothesis. And you know, here again, the short sleep duration is associated with reduced leptin, elevated ghrelin, and increased body mass index. And you can see also here, there is a J-shaped curve. And sleep and obesity, the same kind of correlation. So the less we sleep, or the longer we sleep, and the worse it is for our metabolism. And this is the correlation and the meta-analysis of the sleep duration and metabolic syndrome. And you can see clearly that to sleep less than 6 hours is associated with an increase of the odds ratio, as well as to sleep more than 9 hours. So at the end, the relationship, as I told you, is related to the relationship between sleep restriction, which activates the sympathetic nervous system, which increase the, activate the orexinergic system, and then increase the weight and obesity. But sleep deprivation is not only related to cardiometabolic disease, because a lot of data are now correlating sleep deprivation with arterial hypertension, myocardial infarction, heart failure, Alzheimer's disease, mild cognitive impairment, and also cancer. Unfortunately, there is no time to approach all this, but there is a bunch of literature, and if you want, you can write me and I will provide everything. In 2011, an editorial came out on circulation. And then, you know, the title was Sleep Disturbances, Time to Join the Top 10 Potentially Modifiable Cardiovascular Risk Factors. The answer is, of course, yes. We should, as a physician, as internist, we should ask all our patients how much do they sleep, and we should try to make them sleep more if they sleep less than 7 hours. However, we know that, you know, lifestyle change is much more difficult than to have pills and surgery. However, still the data, strong data from randomized control trials saying that if we made them sleep more using pill surgery, we are reducing their risk, are not still available, but they are ongoing. So in conclusion, this is our review we published in 2 years ago in Nature Review Cardiology. In conclusion, you know, a short sleep that can be just an effect of aging, of our lifestyle habits, or of disease, may be associated to the activation of inflammation, endothelial dysfunction, insulin resistance, oxidative stress, impaired immune response induced by the sympathetic activation. And these are, of course, associated to the development of cardiometabolic disease. So we should try now to test the hypothesis. And so in the future agenda, we should increase the awareness that insufficient sleep is a major risk factor for health, and that physicians, especially internists, should assess sleep in their patient. Moreover, we should assess whether an increased sleep time is associated with a reduction of cardiovascular morbidity and mortality, as well as of obesity. And we should target autonomic nervous system, reducing sympathetic activity and increasing vagal one to improve sleep. So thank you very much. I hope that you have a good sleep if I make you feel asleep, and I'm waiting for your question. Thank you very much.
Yeah, okay. Good evening. Good evening, Mr. Morano. Yeah, do you hear me?
Yes, I can hear you.
Yeah, thank you. Thank you so much for your exciting conference. Believe me, it was very exciting.
Did you fall asleep?
Sorry?
Did you fall asleep?
No. No. We were about to sleep. And when you started your conference, we were all awake.
Good,
so,
good.
Yeah, okay. Mr. Tebaibia, Professor Tebaibia, have a question.
Yeah.
Hello, Nicola. How are you?
Fine, Amar. Fine, thank you.
Nice to see you again, virtually.
Yeah. It's you know, I'm happy, but it's a pity. I would have liked to stay to be there with you, but maybe next time.
Maybe in the future, in 2022, maybe.
Yeah, let's hope.
Okay. I will ask you my first question. Do you have any experience about COVID-19 and sleep apnea? First, and second question, what about association between NASH and sleep apnea? is there a relation between these two diseases, and is there a mortality, high mortality in this situation? Thank you very much.
Thank you very much, Omar. So for the about the first question, so the relationship between COVID-19 and the sleep apnea. So far, there are no reports saying that COVID-19 worsen the sleep apnea. What I can tell you is that in most parts of Europe, the lockdown was associated with an increase in weight. And so, you know, the people who is now working with the diagnosis of sleep apnea is saying that there is an increase of people with sleep apnea due to the increase in weight that they had during the lockdown. So let's say that is an indirect relationship between COVID-19 and sleep apnea. I'm sorry that I did not talk too much about sleep apnea. Maybe in the future I can, because this was my actually what I was working for 10 years. There is a very strong relationship between NASH and sleep apnea, okay? Even because, you know, there is a strong correlation between metabolic syndrome and sleep apnea. We published a paper years ago in which we studied the relationship between the level of steatosis and sleep apnea. And what we saw is that, you know, the association of sleep apnea and NASH was associated with a higher morbidity in terms of both in terms of cardiovascular morbidity as well as in total mortality. So there is a strong correlation between the two. And if you use, for instance, CPAP, you also have a decrease in the inflammation at the liver level. And we showed this in this paper during biopsies. So, of course, if you have a patient with non-alcoholic steatohepatitis with sleep apnea, these two act synergistically, and so their cardiovascular risk is much higher than having only the steatohepatitis without the sleep apnea.
Thank you very much, Nicola. Do you have another question? Venez, venez. There is another question.
You have a very large hole.
For instance, I would like to ask you quickly, no, the question of the colleague, and it will, yeah.
Professor, can we ask the cognitive disorder of sleep deprivation by the anti-CB battery of developed by the World Health Organization?
I'm sorry. So the question is, what is the relationship between sleep deprivation?
Cognitive.
Oui. C'est-à-dire, est-ce qu'on peut évaluer les troubles cognitifs dus à la privation de sommeil?
Ah, okay. If you can use the test of the World Health Organization to test the cognitive status.
Yes, yes.
Yeah. So this is very important because, you know, sleep deprivation is associated independently by the cause. Can be insomnia, can be sleep apnea, can be anything. Is associated with cognitive decline. Not only, as I show, there are a number of papers which have been published recently which correlates Alzheimer's disease development with sleep deprivation. So, of course, you can use the cognitive test to see whether the patient with sleep apnea, they are developing also a dementia. you can use that.
Thank you. Thank you.
Yeah,
Is there any other question?
In my knowledge, there are 3 steps during a night, and which is the most important? Is it the beginning of the sleeping, the middle time, middle night, or the last time of the night?
Thank you very much. This is a very interesting question, because as you saw in the picture that I showed,
Yeah.
you know, the different stages of sleep are distributed differently at the beginning of the night and in the early morning. So the slow wave sleep, which is the most important for cognition, is in the beginning of the night until 2, 3 o'clock in the morning. While the REM sleep, which is very important for the emotional status, is more represented in the early morning. And indeed, you know, we recognize and we remember the dreams that we do early morning, just before the awakening. Otherwise, we will not remember any dreams. So if we deprive the person, if a person go to bed very late, the problem is that he is not able to do a lot of slow wave sleep. So he will be more cognitively impaired. While if a person wake up very early in the morning, so he will lose part of the REM sleep. So cognition will be okay, but maybe it could be emotional, more anxious.
Yeah. Oui. Surtout les premières étapes du sommeil. C'est bon? Alors, il y a une question. Hein? Oui. Allez-y. One more question.
Okay.
Yeah.
Professeur, pouvez le traduire? Est-ce que
Bonsoir.
Bonsoir, Monsieur le Dr. Rani. Est-ce qu'il y a une relation entre la sécrétion de la mélatonine et les apnées du sommeil, les apnées du sommeil et leurs conséquences sur le métabolisme et les conséquences pathologiques sur le corps humain?
Is there a correlation between melatonin and sleep apnea?
No, the link.
Deprivation. The link.
What are the links between the melatonin, which is more used now in Europe, in our continent,
for sleep deprivation?
Yeah, and you had the question.
So there is, you know, melatonin is an important peptide regulating the circadian rhythm. So it has been reported that melatonin is reduced in sleep deprivation. Mostly is reduced in patients with insomnia, also in patients with sleep apnea, because the efficiency of sleep is poor. The use of melatonin, I have to tell you that the guideline for insomnia state that you should use cognitive behavioral therapy first. That is mindfulness, that is, you know, all that kind of cognitive approaches that, of course, are not easy to implement for the overall population. Otherwise, in people with more than 55 years, you can use melatonin. And melatonin is sometimes really helpful because there is a lack of melatonin in sleep deprived. There is only one problem, that if you buy melatonin, the melatonin that you can buy in the pharmacy, we don't know exactly what is the level of purity. And for instance, here in Italy and in Europe, we have, there is only one drug that is called circadin, with a pure melatonin, 99%, and as low release melatonin. And this is very helpful, mostly in older patients, because in older patients with the problem of sleep, we usually use benzodiazepine, okay? But the problem of benzodiazepine is that they increase the risk of fall in elderly, and they increase the risk of fractures. You know, so they're not the best drug to use in this patient. It's much better to use slow-release melatonin. Okay, I hope to have...
But it isn't available.
Pardon?
The best melatonin.
2 milligrams. 2 milligrams.
No, but it isn't available, the best melatonin. But no, we have most generics of melatonin.
I know that the problem of the generic is that when you take 1 milligram, you don't know exactly how much is it. Because, you know, it costs, of course, the price is quite low. And there are a lot of companies producing, but since it's not a drug, they don't provide the level of purity. And so it's difficult to say how much melatonin we are taking. For instance, I remember when I was in US, I was used to take 3 milligrams of melatonin, and maybe, you know, the purity was a little bit comparable to the 2 milligram.
Yeah.
But we don't know.
Okay. Before ending, we have all the all medical doctor here present want to ask you one question.
Yeah.
How about Italia teams and football?
I think I don't, you know, let's say I'm scaramantic, but this year I have good feeling. And, you know, the 3 games, the first 3 games we played well and we scored a lot of, and we will see. It will be tough, but I have good feelings. So thank you for supporting us.
We hope they always win. So thanks so much. Thanks so much.
Thank you.
Yeah, a good time together, and all the team. I hope to meet you in Algeria once this problem of Corona will end. Yeah.
I really hope to come. Next year, I was supposed to come, and then the COVID exploded. This year, let's hope for the next year. I will be more than happy to come and to chat to you and to discuss about football and food.
Okay. As it said in our country, inshallah, we hope to. Yeah. Inshallah. See you soon. Bye-bye.
See you. Bye. Bye, Amar. Bye. Thank you.
The next year, maybe in Algeria.
Good. Thank you. Bonsoir à tout le monde.
Thank you. Au revoir. Merci.
Au revoir.
Au revoir.